We'll be talking about bad breath or a foul smell coming out of your oral cavity, which we call it as halitosis. A lot of patient is coming to me having a concern of a bad breath coming out of their oral cavity. So today we will be talking about like why does it happens and what are the reasons behind the bad smell to come out of your oral cavity. Okay, first thing you should know that the leftover food what we are having, after that the bacteria present in our oral cavity utilize that and produce a very smelly compound coming out of our mouth, which can lead to bad smell of your oral cavity. A lot of the factors play an important role creating a bad smell in our mouth. First of all is your dental appliances, that if you are a denture wearer or having a bridge in your mouth, so they due to the continuous food impaction in the bridge area or because of the deposit and improper cleaning of your denture can lead to a bad smell coming out of your oral cavity. Some patient is having a very irregular eating and drinking habit can lead to a foul smell of your oral cavities. Drinking habits, like if you are a chronic alcoholic, you can face the problem of a bad smell. If you are a chronic tobacco eater or pan chewer, even a smoker, you can face the problem of a halitosis. Improper denture hygiene or a improper oral hygiene can lead to a bad smell. That is, you are not brushing properly, not using a floss, not using a mouthwash, or not scraping off your tongue, because the bacteria present on your tongue can lead to a bad breath. So all these conditions can make your oral cavity smell badly. If your use of food which is having a very strong in its own self and having a sulfur compound, and excessive use of those food like onion, garlic or radish can lead to a bad smell in your oral cavity. Even your systemic conditions, like if you are a diabetic patient, you will be having a typical fruity smell coming out of your oral cavity. So all these conditions can lead to bad smell of your oral cavity. If you are having a cavities in your mouth with due to which a food impaction or food continuous food is getting accumulated in those cavities can lead to a bad smell or a bad smelly mouth. If you are having a gum disease like bleeding gingiva or a periodontal problem or a calculus or a plaque in your oral cavities, these can lead to a smelly mouth. Even if you are a mouth breather, like while sleeping, if you breathe from your mouth can lead to your smelly mouth. If you are not maintaining proper hydration of yourself, dry mouth, which can lead to a dry mouth, it can lead to a bad smell. If you are not eating food at a proper time, that is a prolonged duration of fasting, can lead to a bad smell coming out of your oral cavities. Even some patient comes to me having a like saying that in the morning when they wake up they have a very strong smell coming out of your oral cavities. Morning breath is normal for every individual until and unless you are going with a brushing. Once you are done with your brushing, the smell should subside. If you are not the if the smell is not getting subsided, or if a smell when you woke up it's extremely unbearable, then it's a time for you to visit your dentist. So these are the cause which can lead to a bad smell or a halitosis. So now we will be talking about how the things or how what are the treatment by which you can prevent the bad smell or you can avoid the bad smell. For the first most important, you should stay hydrated, because prolonged duration of dehydration can lead to a bad smell, because the bacteria multiplies in your oral cavities or it stay attached to your denture appliances or your tongue, can lead to a bad smell. You should avoid any alcoholic containing beverages, like any kind of beverages which is having a high alcohol content can lead to a bad smell. You should avoid or subside your habits like chewing, tobacco chewing, alcohol, smoking. You should avoid that, because all these can lead to a bad smell. Okay, if you are having a very high, if you are having a habit of consuming a lot higher quantity of food, which is a which is having a small strong smell in its own self, like garlic, onion, or radish, you should avoid having that. Okay. If your mouth tends to dry very fastly, you should go with non-sugar or sugar-free chewing gum. You should have a habit of chewing gum, which is a non-sugar containing. And if you are a diabetic patient, you should consult your physician and should go with a proper medications. Okay. Proper oral hygiene is very much necessary. That is 2 times of brushing should be there. Proper rinsing of the mouth with the mouthwash or a chlorhexidine should be there. Because of the continuous food impaction on your bridges or between the tooth, food impaction can lead to a bad smell. So you should go with the flossing. There are different type of flossers. Conventional flosser, if a patient is not able to use the conventional flosser or clean the tooth because of the conventional flosser, you should go with a water flosser. It is a very good technique to maintain your oral cavities. If the cavities is there in your mouth, you should go with the restoration of your cavities. Okay. And if you are a denture wearer, you should clean your denture every time, because of the deposit on your tooth surface, that is tartar or a calculus. You should go with the scaling of the tooth surface every 6 to 7 months, depending on your deposit, how the deposit is there. You should go with the scaling. And the for last most important is, you should go with a regular dental checkup. If you are facing the problem very severely, then it's a time for you to visit your dentist and go with a regular dental visit. Thank you so much. I hope you like my video. If you like my video, do share and subscribe to my channel. Thank you.